Hello everyone, how are you today? Today we're going to have a random fertility Q&A, so please let me know if you have questions. We have been getting some questions about cleansing symptoms. Anything that happens that's a little strange while doing a fertility cleanse, people come to us and ask, is this the result of cleansing? Or should I stop? Or what am I doing wrong? Or is this right? Should it be happening? So I'm going to talk a little bit about detox symptoms too when I embark on the cleanse topic starting next week and beyond. So just so you're aware of that. So does anyone else have any questions or thoughts today? I want to open up the platform to whoever needs some support. I suppose I could also let you guys know while I wait for that question. Oh, here's the first one. What do you suggest for men in the cleansing for the first time? There are actually many things men can do to cleanse. It's important to support liver health and cleanse the liver, which is a portion of the fertility cleanse for both women and men. And then there are herbs and different supplements that men can take to begin to support their fertility naturally, their hormonal balance and sperm health and things like that. We do have a male fertility cleanse kit. We have a guide on naturalfertilityinfo.com about male fertility cleansing and the importance of it. So reach out to our team. We're happy to link you to that. But there are several things men can do. The male fertility cleanse kit is a 1-month kit. It's basically a 1-month process, just like it is for women. And we have had several couples cleanse together as a starting point, which I always find is really a cool thing. So there are several things men can do. Yeah. And while I wait for the next question, I'll answer cleanse questions today, I guess. I asked you for questions. It's best not to drink coffee while cleansing. Caffeinated coffee. You could have a little bit of decaf coffee, but especially during the first part of our fertility cleanse where you're supporting liver health and helping the liver function at its best, it's best to avoid those things that tax the liver like coffee or caffeine, and alcohol. Just take a little break from those sorts of things. So here's the thing. I'm going to go a lot more in depth into cleansing next time, so you can come on back. Cleansing is not used to get rid of any fertility health issue. I know you're probably all thinking, what? But fertility cleansing really is about setting a foundation to help your body respond to natural therapies better. It's not a cure, it's not a fix for anything, it's not going to make uterine fibroids or ovarian cysts disappear. That's not its purpose. Its purpose is for helping the liver function at its best to properly metabolize and detoxify excess hormones, and to help your uterus cleanse if it needs it, but also support and boost uterine health. That we feel, and we've learned through our studies, is foundational to helping the body return to balance if there's another fertility health issue. So while cleansing is a foundational step, a starting point, there's something else that probably needs to be looked at after that. If you have a known fertility health issue like ovarian cysts. So it's a starting point, but it's not all you'll need to do. We also have this fertility cleanse guide. It's awesome. It's actually an e-product. You'll sign up and you'll get these. You'll get emails about the cleanse. And I have a physical copy. I was lucky to get a printed copy, but this is not how it appears. It will come to you in emails. But you can go to fertilitycleanse.com. Fertilitycleanse.com. Sign up. You'll get periodic emails and you'll begin learning and start the process if you want to start before I really dig into this whole cleansing process or my talks on cleansing in the coming weeks. So feel free to go to fertilitycleanse.com, and sign up. You'll get a lot of great information. Someone mentioned something I think about fibroids. Could you ask your question again? That'd be great. Anyone else have any questions? I'm sorry you have uterine fibroids. Uterine fibroids can be challenging. I've worked with many women with them. They are known to be caused by, or at least excess estrogen contributes to their growth. There isn't one known cause, I guess, but it's been found that excess estrogen is a culprit. So there are many things to consider. Changing your diet so that you're not eating a lot of processed foods, omitting soy, omitting sugars and things that cause inflammation. So white refined sugar, white flour, omega-6 and 9 oils, all sorts of dietary changes that need to be considered first. Cleansing could be a part of a program if you have uterine fibroids. And then there are some different herbs to support uterine health and strength that you would want to learn more about. There's one specific product that we sell, but it's out there, DIM, D-I-M. Ours is DIM Complete. It's known to help the body properly metabolize excess estrogen, so that's something to learn more about too. But if you go ahead and contact us on our website, we've got an entire guide that talks about what we know about uterine fibroids, what can be considered naturally, when it's time to consider surgery to remove them versus just using a natural plan, and a lot more. So if you go to naturalfertilityinfo.com, in that top right, there's a contact us button. Send an email in and we'll get you the guides that you need and help walk you through them if you need that. The guide's on the website. Yeah, you could just go to naturalfertilityinfo.com and search uterine fibroids. It will come up. There will be several articles, but the main guide should come up on the top. Yeah. All right, anyone else? Any questions today? You're welcome. You're welcome. And if you need us to guide you to the right information, don't hesitate to email or live chat quickly. The girls will get you the right article guide or link to the guide. I hope everybody's doing well today. It's so sunny and beautiful out here. I almost went outside. I didn't want to be squinting. Can uterine fibroids cause pain during ovulation? Uterine fibroids can cause pain in general, depending upon their size. Some women have them and don't know they're there. Other women know they're there. But it's most likely the hormone shift and ovulation itself that's causing a pain you feel at ovulation, especially if it's short-lived, meaning it goes away. Some women do feel ovulation happen. They do feel that follicle rupture, and that's when they have a little twinge of pain on one side at ovulation every month. So I don't really know for sure if what's going on for you, of course. I can't know that, but yeah, I do. I feel ovulation too. It's amazing, really. But it could either be ovulation or it could be uterine fibroids if they're large. Yeah, I have had a couple of, someone said I do and it hurts. Sometimes it really hurts. It's shocking. I have had a couple months where it's caught me really off guard and I wondered if there was a problem. But thankfully the pain went away and I knew that's what was going on. But yeah, ovulation can hurt. Oh, you're welcome. You're welcome. Our site is filled with information. You'll probably find more than you ever wanted to know, but on the flip side, it's there for you because we want you to feel empowered and educated about what you're dealing with and what you can do to naturally support your body. And I guess share information that's realistic too. So enjoy what you find there. And if you have questions, ask us, please. Any advice on IUI? Yes and no. We work with so many women who go through the IUI process, who try IUI. It's intrauterine insemination. So it's basically something that some doctors will suggest before going all the way to IVF, in vitro fertilization. You probably know that, but maybe someone doesn't, so bear with me. Supporting uterine health is an important piece of that. Supporting egg health and uterine health is an important piece of preparing for IUI naturally if you want to. So those are things to focus on. We have a guide titled something to the effect, I don't know the exact one, Preparing for IVF. It wouldn't be different if you're going through IUI. There are many things you can do. Self-fertility massage, of course changing your diet, exercising regularly, making sure that you're getting a lot of antioxidants every day, and that can happen through diet or supplementation. Consider acupuncture. There's lots of great acupuncture for helping make sure flow is happening in the body, circulation is optimal, and lymph is flowing wonderfully, and that the body is balanced. So there's lots of things you can do in preparation for IUI, but mostly, I guess not mostly, but equally as important is preparing your mind for, believing that it will happen, trusting that, your healthcare providers have you in their best interest, that, the process will go as smoothly as it needs to for you, and all of those things. There are different emotional aspects that should be thought about too. So prepare yourself emotionally for the process and however it's supposed to go, right? Yeah. DIM is fine to combine with maca, vitex, and evening primrose oil, yes. And it's really best to take as much as it says to on the bottle you purchase. That is our number one rule. Follow the suggestions of the manufacturer. I have to stick with that. Yeah, so what it says on the bottle is best. There are some general suggested guidelines of DIM. We can get you those if you contact us. Yeah. How long should males and females follow the cleanse for? We suggest fertility cleansing for 1 month. 1 month only. Yeah. I have a bicornuate uterus and thick uterine lining, currently trying to conceive, and so far nothing advice. So for those of you who don't understand, a bicornuate uterus is essentially a heart-shaped uterus. There's some sort of septum to some degree in the very middle, kind of like my pinky fingers. Some women have a pretty pronounced large septum that goes from the top to the bottom of the uterus, and others just have a shorter, they vary. Essentially, your uterus is heart-shaped and it can impact implantation. And this does also speak to the shape of the uterus in conceiving. If you have a heart-shaped uterus or your uterus is misshapen, it can impact implantation of an embryo. It can cause an embryo to, implant in a place where it's not going to get optimal nutrients. It doesn't happen all the time, but it can. And it can also make the shape of the uterus and then the heart-shaped uterus can also make it really hard for the uterus to grow properly if the embryo does implant properly and begins to grow. So there can be pregnancy complications. It's not true for everyone, but it can happen. Most doctors address a bicornuate or heart-shaped uterus with surgery. Surgery does not come without the potential for complications or scar tissue. We all know that. But sometimes that's the best first step. It would depend upon your situation. Your doctor would have to evaluate the size of the septum or the thing that's making it bicornuate, right? I don't know the technical term for what they call that thing that grows, the little wall essentially, to see if surgery might be the first step or not. I have never heard what a corkscrew uterus. I have never heard of a corkscrew uterus, and I don't know what that means. I'm sorry, that's hard. I would have to do a little bit more research. If anyone else has heard of that or has some thoughts, you certainly could chime in. Nonetheless, back to uterine shape, it can impact chances of pregnancy and pregnancy should it happen. There are things you can consider. There are a variety of massage therapists who might have experience and be able to help. Mercier therapy, that's M-E-R-C-I-E-R. It's Dr. Jennifer Mercier. She created this therapy that's all about womb massage, essentially. There's a company called Clear Passages that works with women and fertility health issues. I don't know if they do anything with bicornuate or uterine shape, but you can check into them. There's something like self-fertility massage that might be helpful. Again, you're going to want to talk to your doctor about whether or not surgery is the best first step, and then maybe natural therapies after that, or consider natural therapies after that, things to help prevent excess scar tissue formation and to keep the uterus healthy afterwards. There's a lot. I could probably ramble on and on and on. Red raspberry leaf tea is amazing for uterine health and uterine tone. But you first would want to talk with your doctor about the severity of the issue. Have them explain what corkscrew uterus means exactly, and then go from there. Yeah. You're welcome. I kind of rambled there. I know other people were asking questions, so ask them again. But I'm sorry you've had to deal with all of that. You're welcome. Is it true that female hormones are made in 3-month batches, and so doing a 3-month cleanse may be good? Well, our hormone production is cyclical, but it's not every 3 months. It's monthly. There are different hormones that are made from when your period starts until ovulation, and then different levels of hormones are made from ovulation until when your period starts again. And even different levels of hormones are made when you get pregnant, in pregnancy. This waxes and wanes every month, not every 3 months. I think there may be a disconnect in information here. It takes an egg, an ovum in the ovary, 3 months to mature to be ovulated. That might be where the disconnect is, but 3 months of fertility cleansing all at once is too much. Yeah, you only need to cleanse for 1 month. If that's your choice to do that as a starting point, and then other natural therapies can be used after that to support your body in returning to balance, whether you have a fertility health issue or not. There would be different things for different issues, or if you don't have an issue and you're just wanting to be as prepared as possible and as healthy as possible. So I've not ever heard that our hormones are produced in 3-month batches. I don't think that that's true. You're welcome. You're welcome. Someone asked about ashwagandha for fertility. Ashwagandha is a fabulous stress reducing, yes, ashwagandha, thanks for asking again. Fabulous stress reducing, immune boosting herb. You should learn more about it. I actually just started taking our Fertilica ashwagandha this week in preparation for this day. I sent my oldest off to kindergarten and was needing a little stress support, so I started taking it this week. And I can't say that my stress is gone, of course, because that would be unrealistic, but I've definitely felt myself on a more even keel today and this week. So look into ashwagandha. Yeah. If you're not here to learn and be serious, you can go bye-bye now. Thank you. We're not talking about sexual position at all. So you're welcome. Yeah. Does everyone ovulate 14 days after your first day of your period? If you have a 28-day menstrual cycle, you probably will ovulate between day 12 and 14 of your cycle. But no, the answer is no. Not everyone ovulates exactly 14 days after the first day of their period. Some women do, many of us don't. Your period is 32 days regularly. So normal ovulation, normal healthy ovulation should happen about halfway through that cycle. So roughly day 16, you may want to start using OPKs and tracking for ovulation. If you're charting all month long, of course, but using OPKs roughly the week before, a few days before day 16, just to see if you can detect that LH surge. And yeah, it should happen about mid-cycle. I ovulated 5 to 6 days after. I was lucky the first try with my baby. Oh, fabulous. Congratulations. Yay. Okay, so that is a problem. I've been having a really hard time finding out when I ovulate because my period is irregular. That's definitely hard. Yeah, detecting ovulation when you have an irregular period is really hard. Ultimately, what's going to be best is to try to chart your BBT every day, to track on a physical chart with someone like Fertility Friend. If you guys haven't heard of Fertility Friend, it's amazing. Check it out. Something like using OPKs might be more challenging and really expensive if your cycle changes, but seeing it on a calendar is really going to help you a little bit more. And working to try to help your period become regular if you're still in that phase of life where it can be. Yeah. Someone mentioned they're going to be 43 and want to be a first-time mom. Can it happen naturally? I want you to have hope. I want you to believe that it can happen if that's what your heart wants. And I want you to educate yourself on about everything you can do in your power to prepare for that to happen, or to help your body return to balance if you have a problem. Natural conception at the age of 43 is not completely impossible. So have hope. Yeah. Oh, good. You use Fertility Friend because of PCOS. That's great. Someone else uses, I think FFT. Does that stand for Fertility Friend? I'm not sure. Or baby T charting. Anyway, their Fertility Friends helps with basal body temperature charting. So this is the second person loves it. I haven't actually ever charted myself, but I've gone through all of Fertility Friends courses, and I look at charts, and I've studied charts. And it seems like Fertility Friend makes it really nice and easy. Do I recommend CoQ10 and vitamin D? I would recommend CoQ10 and vitamin D. Vitamin D, certainly for anyone who lives in a place where you have winter and a lot of gray. I think it's pretty normal that people are taking vitamin D now, and doctors are suggesting supplementing with vitamin D. But I definitely would suggest CoQ10 if you're feeling like you have an egg health issue, or you want to boost egg health because you're 40 or older and trying to conceive or wanting to try to conceive naturally. Some people find out through testing that they have low levels of CoQ10, so that would be and vitamin D, so those would be reasons to supplement as well. If you ovulate on day 10 of the cycle, is it too soon? I only have my period for 2 days. How long is your cycle in total, from the first day of your period until the first day of the next period? It might be a little bit too soon, but if everything's seemingly normal, and that's the pattern month after month after month, that might be your normal. It might not be too soon for you. There are some experts who say a 12-day follicular phase is important, but a 10-day one, does that mean you're not going to ovulate or conceive? No. All right, great. Thanks for joining. Yeah, come back. Come join our cleanse talks as we begin that. A 25 to 29-day cycle, it can be normal. It might be just a slight short at 25 days, but I think I would need to know more. You should email me, contact me, and let's talk more about what you go through in your experience, so it's not all here live for everyone to see and then going to YouTube afterwards. Send me an email and let's talk more about your periods, and we can talk through that. And someone just asked, thank you for typing that again, about stopping supplements for a month before beginning IVF prep. In most cases, we say 2 weeks. Stopping herbs and supplements within 2 weeks of starting your medications in preparation for IVF. So you're going to be stopping before, but as soon as those medications are started, well, you'll know when those medications need to be started, and we want you to stop about 2 weeks before. But talk to your doctor, because there might be some things that he's okay, or he or she is okay with you continuing. It's not the case with everyone, but if you don't talk to your doctor, you need to stop them within about 2 weeks. Someone asked for my email address. What I need you to do is go to naturalfertilityinfo.com. Top right-hand corner, there's a contact us button. That email will come into our team, and they'll pass it on to me, or if you address it to Elizabeth, they'll pass it on to me. If you're open to any of us helping you, there are 4 of us who answer emails. We're all very knowledgeable and willing to help you. You can just address it to the team. Let them know that we chatted on Periscope. All right. Well, thank you for joining. For those of you who are continuing to join, please replay and watch again. And I hope to see you all in the coming weeks as we begin talking a little bit more about cleansing and detoxing in preparation for conception. And I hope you have a great remainder of your day. Take care. Bye-bye.